Hi, I'm Maria and I'm going to discuss RN recruitment and retention. Nurses are critical to healthcare. Did you know that nurses make up the largest section of the health profession? High turnover rates and low retention of nurses pose a significant challenge to healthcare worldwide. Organizations with higher turnover rates are facing a higher financial burden to recruit, replace, and train new staff. Older nurses are retiring, and newly graduate nurses are making up the largest percent of working nurses. Although there are generational differences, key drivers for retention are the same for all nurses. However, strategies for retention are not the same for every nurse. Rural areas have been left with increasing shortages, and what nurses are left are struggling to keep their head above water, at times, so to speak. Bedside nurses are working as nursing assistants, while advanced practice nurses and nurse administrators are working as bedside RNs. For millennial nurses, opportunities for professional growth are important. No matter the organization, a high-quality orientation can help retain employees. It's been proven that nurses who feel prepared do not feel as overwhelmed. I think we all can agree to that. Another key thing to remember is that when nurses feel that their pay is fair, their voices are being heard, and they feel like they matter, they will be less likely to seek other employment opportunities. I think we've all been there too. Let's talk about some ethical considerations. We all know that nursing can be physically demanding, emotionally exhausting, and very stressful. And COVID-19 has just heightened those ethical tensions that we feel. So due to COVID-19, those ethical tensions have heightened, and as patients are being admitted into hospitals and nurses are becoming aware of the lack of professional resources, nurses are coping with unrealistic workloads, risk of infection, stigma directed at healthcare workers, as well as mental, emotional, and moral burdens of caring for our patients. With more nurses leaving current positions or leaving healthcare altogether, recruitment and retention strategies are becoming even more imperative for healthcare facilities. A nurse's health and well-being are affected by the demands of their workplace, and in turn, this affects the quality and safety of care that we as nurses can provide. Nurses who report more ethical stress show a lower level of job satisfaction and a greater prevalence of intent to leave their current job. So, in conclusion, high turnover rates are posing a significant risk to healthcare worldwide. There are many challenges that nurses, administrators, and healthcare facilities are facing during the nursing shortage. Recruiting newly graduate nurses may be key in helping combat the nursing shortage, while offering seasoned nurses the opportunity for professional advancement may also be another possible solution for retention. Nurse leaders are important for creating a positive and supportive work environment to keep staff engaged and satisfied. So, here's some questions for further discussion. What are some of the challenges for recruitment and retention of nurses that you see where you live? And what are some of the ways that you feel like the facilities where you work can recruit and retain nursing staff? Nursing is a very, very, very important profession. And it's very important that our healthcare facilities realize that retention and recruitment strategies are very important for the future of our healthcare. Thank you for listening, and the references can be found at the end of the PowerPoint.